Hello, everyone. Welcome to ALA's Smoke-Free UOP workshop. We will be presenting on electronic cigarettes and the dangers of vaping. My name is Emma Wen, and Ryan Kwong will also be presenting with me. So let's get started. So for our objectives today, we are going to learn about electronic cigarette devices and the chemicals that are used in vape juice. We're also going to understand the risks that come with vaping, as well as assess whether electronic cigarettes are harmful or helpful in quitting smoking. We're also going to learn how to start quitting or help others quit. And we also have a survey and a discussion and journal session. Here are just some statistics. So who is using electronic cigarettes? In 2020, 3.6 million US middle and high school students used e-cigarettes in the past 30 days, including 4.7% of middle school students and 19.6% of high school students. In 2019, 4.5% of US adults were current e-cigarette users. In 2019, among current adult e-cig users overall, 36.9% also currently smoke cigarettes. 39.5% formerly smoked cigarettes, and 23.6% had never smoked cigarettes. Among current adult e-cigarette users, the percentage who have never smoked cigarettes is highest among those aged 18 to 24 years, which make up about 56%, and is lower in older age groups. So what exactly are electronic cigarettes? They are battery-powered devices, which are known by many different names. Down here, we show different devices that people use. They have e-pipes, e-cigars, large tank devices, rechargeable e-cigarettes, and disposable e-cigarettes. They come in many shapes and sizes. E-cigarette liquid typically contains nicotine, polyethylene glycol, glycerin, flavorings, and other chemicals. So what do we know about the effects of vaping? We know the juice can contain nicotine flavors such as diacetyl, a chemical linked to a serious lung disease, volatile organic compounds, cancer-causing chemicals, heavy metals like nickel, tin, and lead. Nicotine is highly addictive. It is dangerous to pregnant women and toxic to developing fetuses. It also harms brain development and is poisoning through acute nicotine exposure. Not as harmful as regular cigarettes, but still harmful. We know that also there are defective batteries that can be found with certain e-cigarette devices, which can be dangerous.
Hello, everyone. So my name is Ryan, like Emma mentioned earlier. And so what are some of the effects of nicotine on the body? Well, it will stimulate the adrenal glands, which will release epinephrine or adrenaline. And it will also stimulate the sympathetic nervous system or SNS, leading to an increase in heart rate and blood pressure, as well as breathing rate. And it also may contribute to hardening of arterial walls, which can lead to a heart attack. And it will also increase dopamine levels, which reward behaviors, causing it to be super addictive. And then there will also be withdrawal effects to keep you on nicotine. And there's this condition called EVALI, or e-cigarette or vaping product use associated lung injury. And this is a new disease that affects otherwise healthy individuals. And it can range from minor to fatal cases. And there have been over 2,800 cases of hospitalization or deaths between August 2019 and February 2020 in the US alone. And there's not a single test to diagnose this disease, and the symptoms that are associated with this disease are also similar to other respiratory illnesses. And the only risk factor that we know of so far is current or previous use of e-cigarettes or vapes. And it's also strongly linked to vitamin E acetate, which is added to some of the THC containing vape products. And this is the big question. Do electronic cigarettes help when you're quitting smoking? Well, the FDA hasn't approved of it as a legitimate method because there's very little evidence, but it may help non-pregnant adults if they completely substituted cigarettes and tobacco products with e-cigarettes. But most of the time when cigarette smokers start using e-cigarettes, they end up using both products, which isn't good at all.
How to start the quitting conversation. So you want to look for opportunities to respond positively when a smoker mentions something about quitting vaping or smoking cigarettes. Just hearing someone being encouraging when you are kind of on the fence maybe about quitting smoking really helps. You can also create an opportunity by asking them about if they have thought about quitting and just starting the conversation. You can also ask them if they have thought about the negative effects from vaping or smoking. Most cigarette smokers and vapors do know the negative effects about vaping or smoking, but it's always good to just see if they do or don't, just to see. And it also just starts the conversation. How to support a friend or family member at any stage in their smoking cessation process. You can always ask questions, ask how they're doing, ask how they've been coping, if they found anything new to do, and just listen to them. It's always best not to lecture them, that can always be like discouraging. Offer distractions, help think of replacement habits like chewing gum or squeeze stress balls. Also being just patient and positive, and just being encouraging. Don't be too hard on them if they slip, and celebrate the small successes. Tips for individuals trying to quit. List out reasons why you want to quit. Just having a list of reasons just to remind you why you are quitting can always help during those rough days, and like just keep on encouraging yourself. Figure out why you're inclined to smoke. Avoid secondhand smoke, even friends that smoke if necessary. Just being around people who smoke can be pretty triggering. Distract yourself. Quit smoking programs like Smoke Free and Quit Now are also available, either online and also like just to call in. You can also get nicotine through different methods and slowly taper off, like lozenges, gums, patches. You can always go to your pharmacist and see what the options are if you are interested. Nicotine-free prescription medications, have people you can turn to for help, make a plan, and set milestones. Don't give up if you just slip. You can always just start again. It's pretty easy to sometimes slip when trying to quit because it's really difficult, but it's better to just keep on pushing forward and know it's okay if you just mess up. You can always just start again.
Okay, so now let's discuss. We've prepped some questions here and you can help us answer them. First of all, what would you do if a family member or friend doesn't want to quit? Well, sometimes nothing will work, and ultimately it is that person's life to live and they deserve to live it the way they want to. But that doesn't mean you should just stop trying. You can continue to use the methods that were mentioned earlier in our PowerPoint and just keep going at it. Are there any other ways that you can come up with for situations like these? How can electronic cigarettes be less accessible to middle school and high schoolers? Some of the solutions that we came up with would be to educate the retailers so that they're more aware about situations like these, and to raise the prices of electronic cigarettes, like how the normal cigarettes prices have been rising. And what are some other ways that you can come up with that could be solutions to this problem? And what would be good replacement habits and activities for vaping? Well, basically, you just have to find a ways to keep yourself busy, whether it be work or hobbies. Like, for example, you can keep your hands busy by finding something like maybe a pen and just clicking it and fiddling with it. And if you will need to keep your mouth busy, you can just chew gum. And so obviously these are just a few reasons, a few methods, and you can always find something that works for you because everyone's different. And then how can you show your support to someone who is trying to quit smoking? Well, you got to be able to celebrate with them for all their successes, no matter how big or small they are. And if they mess up, you should give them encouragement so that they can restart and stay on their path to quitting. What other ways can you come up with to show your support? And then here's some questions to just think about. What does the smoke-free campus mean to you? What would it be like to be smoke-free? What improvements would you see in your day-to-day life? And what are some smoking cessation initiatives that you would like to see on our campus? And here's a quick survey that the link will be in the description below. Thank you for joining us. And here's a few extra resources. And here's our sources. Thank you for listening.